Hello and welcome to my little presentation, A Meeting of Minds, or in other words, finding the therapeutic space between two people when they meet. Now what does a meeting of minds mean? No, not mimes, minds. That's right. When two human beings with the shared human experience get together to achieve a task, that space that forms between them, the therapeutic space, is a consequence of the meeting of minds. Take it away, Andrew.
Okay, this session we're going to be looking at the therapeutic space. Okay, what is the therapeutic space, I hear you ask? Give me a second, I'll come up with a definition. Okay, no kidding, it's been around for ages. The therapeutic space is the space that develops between you and a consumer or a patient, if you're in a general hospital, that you're working with. It develops between you, and it's part of the human interaction. It's part of what makes human beings, when they're together and present in the moment together, they develop a relationship, right? They develop this space between them, and it becomes almost its own entity. Okay, now if it's a relationship between friends, it'll have a particular sort of flavour, or if you're a sporting team, it's a relationship between teammates, goal defender, goalkeeper, you have a bit of a relationship, and there's a space between you. In a therapeutic space, it is there so that there is therapeutic gain. Okay, that's the nature of therapeutic space. It is there for the consumer to gain therapeutic advantage and therapeutic progress. Okay, a positive upshot is that the nurse who's working with them also gains something out of it. You can't not gain something out of a good therapeutic interaction. It's good for the soul. I won't digress. Okay, so therapeutic space. So here we have a person. Okay, now it's not the whole person. It's just their ego. This is the bit we've got to work with. Right? It's the part of them that they're presenting to the rest of the world. Right? It's the person's ego. And they're sitting on a terrible drawer, sitting comfortably with their oversized feet and their undersized arms, sitting in a chair, having a chat. Chat, 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 chat. Good Lord. Okay, so here we have a person sitting, having a chat with another person, a therapeutic chat. What's a therapeutic chat? We might talk about that at another stage. Okay. And here you have another person, not the whole person. Well, the whole person's there. The only bit that's really engaging is the ego, the part of them that is connected with the outside world, their sense of self, the one that says, I am me, I am this ego. Right? And they're sitting there with their small feet, different chair, overlong arms. They're happy too. Okay. Chat, chat, chat. Okay, so we have what you would call this, to give you a framework that means the same thing to everyone in the industry, almost everyone in the industry. It's a meeting of the minds. Okay, meeting of the minds, meeting of the minds. This may not be a meeting of the minds. This may be somebody going through the motions. Okay, for example, let's just say this one is the nurse or the recovery support worker or the consumer recovery companion or the cleaner. This could be the consumer or the patient or the client, whatever you want to call them. Okay, and the meeting today to talk about how to spend your day, right? They got, since their life changed, they were in uni, they dropped out of uni, now they're trying to rebuild a life, find purpose, find a reason to get out of bed in the morning. We all need a reason to get out of bed in the morning. Okay, so they're talking about things, they're explaining and they're talking about stuff. Now, if the person who's supposed to be engaging with them is there in the moment. They'll be listening and reflecting back and paraphrasing and using all those little micro communication skills to ensure that they've understood the message, right? So that this person feels heard, this person hears accurately because they check, right? And this therapeutic space develops, right? So the next time they see it, they're glad to see it because the therapeutic space is comforting. It's food for the ego. It's food for the soul. I'll say it again, okay? However, let's just say same scenario, but instead of being there in the present, listening and engaging and using all those micro communication skills, what about they're distracted? And they're thinking, what am I going to have for dinner? I'm hungry. I need to have dinner. Okay? They're not in the moment with them. You couldn't call that a meeting of the minds. You can call that a waste of time and effort. Really? I'd call that a waste of time and effort. If you want to be there, be there. If you're not going to be there, at least have the decency to say, look, I just can't get here with you at the moment. Can I catch up with you in 10 minutes after I've had something to eat? Or after I've organised my dinner menu, whatever it is. That level of honesty actually feeds the bucket of caring, the therapeutic bucket. Okay, so therapeutic space is this space that develops between two people. One is usually a bit more screwed up than the other at any particular point in time. It's not always the consumer. It can be the rest of us, because there's no real difference between consumers of mental health services and people who aren't yet consumers of mental health services. We all have mental health. We all have mental wellness that we're trying to achieve and mental stress. Okay, so it's usually, in a formalised setting, it'll be the consumer that has most issues, but not always. The staff, God, you go to any nursing tea room and half the people there are talking about their issues and the other half are waiting for their chance to talk about their issues. Right? They're usually complaining about things they can't change. Okay, so there you have it. That's Meeting of the Minds 101.
Meeting of the Minds 101 indeed. What a great presentation. Now that, I hope, becomes a foundation piece for your future efforts in mental health nursing as you develop your relationship skills, as you develop your own model of mental health care. You have to remember the foundation stone is this meeting of minds. It's the meeting of minds that allows relational-based nursing to be done. Thanks for watching the presentation.